The following program does not necessarily represent the views and opinions of Reality Radio 101, its advertisers and sponsors, or its listening audience. Listener discretion is advised. Good afternoon and welcome to the Bear Psychology Radio Show with psychologist, author, and speaker, Dr. Anna Baranowski, where mind, mood, and what matters to you are discussed. We're broadcasting live from Toronto, Ontario, Canada, on Reality Radio 101. So get ready to talk, email, or post a message to us. Our email address is instudio101@gmail.com. And now, right to your host of the Bear Psychology Radio Show, Dr. Anna Baranowski.
Hi, everyone. I'm so glad to be with you here today. I know that these are absolutely unprecedented times. We're trying to figure out how to navigate this together. There's nobody who's different in all of this. We are all in the same position, and we all have to do many of the same things to stay well and stay safe. But you know, there's a whole bunch of people out there who are essential workers, first responders, frontline workers. And these include, emergency room staff, doctors, ambulance attendants, paramedics, nurses, clinicians, mental health practitioners, pharmacy staff, grocery staff, people who are still serving food and drinks, maintenance people, construction workers. There are a lot of people who are still showing up every day to help us function, live, and deal with the demands of this world right now. And I want to use this time today to talk about what it's like to be out there to do this work at this time. And I have two incredible guests today. Dan McGuire, who is the president and senior consultant of FISM Perspective in Rochester, New York, and he's going to help us focus our discussion on the impact of responding to COVID-19 emergencies on first responders specifically. He was actually certified as a New York State Advanced Emergency Medical Technician for 20 years and was a past EMS chief, and now he provides training and consulting services to establish emergency responder wellness programs. So we can imagine that his perspective is pretty crucial right now, but I'm actually thinking about how important Dan's work is going to be 3-6 months in the future, a year in the future, to those first responders who were engaged in their work during this time. And I also know that Dan worked in a hospital ED trauma center for 5 years. So he's very well developed in his sense of what the hospital staff are most likely enduring as well. Now, we also have Dr. Brad Lindell, who joined us just 2 weeks ago when we were back, when we had our first conversation about COVID-19. And Dr. Brad Lindell is the president of the National Center for Crisis Management, which is a multidisciplinary network of professionals who are committed to improving the support and intervention provided to victims before, during, and aftermath of crisis situations. And the center works in collaboration with the American Academy of Experts in Traumatic Stress and is an organization comprised of multidisciplinary network of professionals committed to the advancement of intervention for survivors of traumatic events. So I want to thank you both for joining us in this conversation today and being here to kind of help us with this conversation. So thank you both.
Great to be here. Thank
you.
My
pleasure.
Great. You know, what I want to do is I want to actually just start with a soft story. And this is really something that comes right to my doorstep during this time. And it's really all about how local neighborhood, friends, family are starting to really notice the people who are still out there working on the front line and you know, showing up every day. My husband works in a hospital. He's a cardiology nurse, and he you know, he's there providing services to the people who arrive on his floor, some of whom have been COVID patients because the screening has not been altogether perfect. And so he has found himself providing care to some of the COVID patients. And, you know, it's interesting because people in my neighborhood know who my husband and I are. You know, we're involved in some community things that keep us engaged. A couple of nights ago, I had a very late night at work. I'm still working every day as well, and that means I'm going to my physical office primarily because I have a lot of insurance-related cases and matters that require that I look at my physical file. You know, or possibly if I don't get a chance to take a look at the physical file, I might miss something. And if it's an insurance issue, I don't want those people who are receiving insurance benefits, maybe because of a loss or an injury or an accident, to not have continued insurance coverage, especially during a time like this. So I go out, I come home, it's close to 8, and my husband goes out to the hospital, and when he gets home, it's close to 9. But when I came home, there were 2 bundles sitting on my front porch, and I opened them up, and I found 2 bags, separate bags, filled with the most well-made, homemade cloth masks you could ever imagine. So this is really a call out to these really wonderful volunteers. They created a Facebook group in the Toronto area called Homemade Masks for Hometown Heroes. And I just, you know, it was one of those funny moments where I could just feel my heart expand and realize how we really are in this together, and how these little acts of kindness, they actually make a huge difference. So I just want to kind of make it clear how important these little things can actually be, and how, in a way, they're not little at all. So I want to hear from both of you what you're seeing and hearing. And I know, Dan, you were telling me a little bit about what you're hearing from those frontline workers.
It's a completely different picture than what we've had to see since September 11th, to be quite frank. And I want to be very delicate comparing this to September 11th, since there's still many people that are still dealing with that event. But we're seeing our healthcare system not at its best, and where we don't have all the right people in the right places, equipment in the right places where it needs to be, and yet I'm seeing some very positive signs of a company over in Germany just sent over 50,000 masks to help, and you know it's starting to happen. And but talking with the firefighters, especially the EMS, law enforcement, They are just, and the word I hear continuously is we're scared. We have a great deal of fear because we know our jobs, we know what to do, but because there's so many limitations with dealing with this unknown virus that you don't know who your next patient is going to be. And with the story that I read yesterday, that many of the this is happening in New York City. New York City EMS is being bombarded with ambulance calls, more than 2,000 to 3,000 per day than on a normal day. And what many of these patients are doing is when they call into 911, they don't tell that I am having trouble breathing, I have a fever, I have chest pains. They're using a complete different set of symptoms just to get the ambulance there. And then once they get them to the hospital, that's when they spill the beans. Oh, by the way, I've had a fever and cough for the last 2 weeks. And this is just putting our emergency staff on all sides, EMS, the hospital, the ED staff, everybody at just this continuous risk because of just the panic that we see in today's community.
Yeah, I understand what you're saying. That's a story very much like what we were seeing at the hospital that my husband works at, that somebody did not identify some of these symptoms and then ended up on the unit that he's on, which is a cardiology unit, and should not have ended up there really at all. Was eventually identified properly as COVID query and then received the COVID positive. But I mean, it surely puts the frontline workers at risk because, if they're exposed without the right garb, then, there is always the potential of bringing that home. Just like there is like for myself, being married to somebody who's, always going out there and into the hospital setting, hospital settings, they get exposure in many multiple ways for sure, just like those paramedics who are very bravely going into these situations. So really it sounds like for me, the call out is please give the correct information so those essential workers can respond properly so that they can keep themselves safe and that they can move on to the next call safely without contracting anything, because they really need the right information to handle any given call correctly. But the truth of the matter is, at this point, I think every essential worker should be pretty covered and careful because of the kinds of situations that you're talking about.
And it goes back to our most basic training that was called the universal precautions. You gloved up for anyone, no matter what, because you just simply didn't know. And a story that I want to share, my first week when I worked in the ED, the nurse manager came up to me and she says, now you have 2 pair of sneakers in your locker. I said, no, I just have the ones that are on my feet right now. She said, no, you are going to need 2 pair of shoes, one to wear while you're here and another pair to when you go home, because we don't want you taking any of this back to your family. And that's really sticking out of my mind right now with all of the challenges and the frustrations and the fears and the angers that are in these everybody in the emergency delivery services, that they short on this and they're working overtime. And I even just finished reading a story that many of these people are dropping from dehydration because they're having to get into their protective suits so quickly, working 12 hours. They don't have a chance to eat anything that is nutritional based. Nothing for hydration, and these people are becoming almost like a secondary patient because their body and internal workings can only go so far without that proper nutrition and self-care.
Yeah, absolutely. And that is actually quite a risk factor, if the demands are so extreme. And nobody's really taking care of the frontline workers. Who's taking care of the frontline workers, right? And so we really need to be very aware of, what protocols need to be put in place so we can ensure that, all those frontline heroes don't, really succumb because they simply have not been taking care of themselves, not even because of COVID necessarily.
No.
We've got a letter from one of our listeners, Darren Gregory, who is echoing many of the things that you're talking about right now, Dan, and he says that he has been quite concerned for the frontline workers for some time, and the COVID pandemic has elevated his concerns. He was also previously a paramedic and is now retired. He says prior to this current crisis, those working in the front line from the ranks of those working in public safety were already letting us know that they're in some trouble. And it seems that regardless of our collective best efforts as advocates on behalf of Canada's first responders, there's been little change in the continue to suffer through. So, I think this is really, quite a concerning statement, because what he's telling us, Darren, is that even prior to the pandemic, suicide and mental health issues in general were an issue amongst around first responders. And that, now we've got this pandemic, and what kind of impact are we going to see at this point? And what kind of response needs to be put in place to really address that? And that's really, something that we all need to be contemplating to make sure that there is, the right care and the right response for these frontline heroes.
Yeah, and that's always been a challenge with the emergency responder. We are trained from day one that we're very independent. We take care of ourselves. Nothing's going to hurt us. We will always win, but that isn't the case. And with all the CISM and acute traumatic stress management training that I do over the years, I am really trying to focus on what I call the critical incident, pre-incident education. My term is, let's do a better job of getting to them before it gets to them, and getting more time in these academies and basic EMT classes and even these basic medical classes, so a whole lot more what you're going to hear, see, feel, taste, touch, all of those imprints, and making sure that you are ready for this. And I think we're behind the ball on that now, and I think that's going to have to be a very large focus once we get to a point that we can start delivering these programs.
Yeah, I agree, absolutely. Now, here's another question that came in, and it's really an interesting one, and I'm actually going to see if Brad can address this, because I think it's very relevant given that you work with such a young population. I'd like your thoughts on it, specifically, Brad. Mm-hmm. So this is from Ray, who says, "Hello, everyone. This is such an important topic today. Thank you for it." I'm so glad that Ray specifically is sending this email. He says, as a frontline worker, he's working in a grocery business. Okay, you get one working in the grocery business was ever taught how to be a first responder. They didn't sign up for danger pay. Here they are all of a sudden in a role where their lives are potentially at danger. Even we see our, the folks who are driving our buses and, working in, pharmacies, like handing coffee to people at Tim Hortons, right? So Ray says, "I cannot believe how many people are still not taking this virus very seriously. It is usually the younger customers who act like this. But my question to you is this: what can I say to them to make them understand the urgency of this horrible situation? Thank you for the topic today, Brad.
Well, there are certain things that are inherent in young people, and that's their sense of invincibility. That they don't believe that things can happen to them, that things still happen to other people. And, they vary in their sense. It comes with maturity that we start to appreciate the fact that we are vulnerable to things. To give them as much fact as possible, personal stories about, even young people who have been affected, to make it more of a reality. So you do penetrate that sense of invincibility that they tend to have, especially adolescents, young adults. Anything that can hit home with them that they might be able to identify with and say, gee, that could be me. Just like, we do now as we're older, we see that can happen to us. That's going to make them think a little bit more, maybe reflect a little bit more on that sense of invincibility that they have. And hopefully will result in a change in behavior. So it's difficult, but like I said, factual, straightforward, and things that they're able to relate to.
Okay, so I want to make that really, really simple, and this is for Ray. I want you to put a sign up in your grocery store, if the business will allow you, that says something like, "Please help me stay well so I can continue to help you." Sometimes the message has to be absolutely crystal clear that my being well is to your benefit. And I don't want people to forget that when it comes to you, Ray. I want you to be able to say that loud and clear, even if it means wearing a T-shirt that says that. If you're going to be out in the public, I want you to stay well, because I know what you're doing is crucial. And it's not something to be taken lightly. So please help me to stay well so I can continue to help you. What do you think of that?
Yeah, that could hit home also. Again, anything to get them to think that'll hopefully, result in a change in behavior.
Yeah.
And if I could, it's something that I actually saw in a store here in the Rochester area was help us to keep you alive.
Oh my God, that really hits home.
Well, yes, because, and I'm going to sound like my grandmother, my mother, and all my other elderly family members. We have challenges with certain parts of our population of, what's in it for me first, and I really don't want to. Well, I don't want to expose your call in, but sometimes it takes that bluntness of a message to cut through some of this. As Brad put it, that they're invincible. There's nothing's going to happen to me, and that's very much like with our new EMTs, paramedics, firefighters. They think nothing's going to happen to me. I'm going to be superhero till they see one of their own members get killed in the line of duty, and it changes everything. And but that's I actually went to the person who owned the store and thanked him for that, for being that honest and that forward, that for help me to save your life by social distancing, wearing a mask if you think you're ill, and stay at home for as long as you can, except for top essential necessities.
So, okay, let's just talk for a moment about what you just said. Wear a mask if you think you are ill. And I would actually say wear a mask, period, whether you think you're ill or not. For one thing, we now know that the COVID-19 hangs in the air. So, if you're in an elevator or you're in any kind of enclosed space, if you're walking through a cloud of somebody's cough or sneeze, you can catch COVID whether or not somebody has sneezed in front of you, or, like you don't expect these things. So wearing a mask, it just adds one little layer of protection. Obviously, if you're feeling ill, you should be wearing a mask too. But whether you're ill or not, because COVID you can have COVID without any symptoms. And so whether you feel ill or not is irrelevant. Like for the first little while before, all my staff are now working remotely, but for the first little while before we were working remotely, I would be going in and out of the main area, wearing goggles, masks, and carrying hand sanitizer, not because I was ill. I'm perfectly healthy right now. But because what if I was ill and I was asymptomatic and I passed it on to somebody I cared about? That wouldn't sit right with me. So whether you're ill, whether you think you're ill or not, wear a mask. That's what's being recommended now. Wear a mask. So I just want to reinforce that to everybody. Don't take this lightly. Let's protect those frontline workers who are out there who want to continue to work, do their job. We need to do our job too. Stay home. And if you must go out, protect yourself and protect others.
Well,
good point.
So this is from Shane, who says, I cannot tell all of you how grateful we are for the work that you do and are currently doing for this health crisis. You are the heroes of the world right now. Thank you. Oh, well, that's very sweet. Huh. Very lovely. Yeah. I mean, and I think that just having this conversation is a really important thing because people feel very alone in all of this. They're watching this unfold, and it is a scary time. I wonder what kinds of thoughts both of you have about, the feelings of fear and uncertainty that people are telling you about.
Well, I can speak. I deal a lot with with adolescents, and of course they vary to some extent. Again, that when I made reference to the invincibility before, but other ones are being pretty much very much affected by this. They're worried about their family members who need to work. They're especially those that are in the medical field. They do realize that it's a very difficult time for their parents to be out there. They realize that the parent is feeling torn between what they need to do for their job and putting their own family, at risk. And there's disruption in sleeping patterns, especially since, there's a lot of schools are closed right now. So they don't have that structure. They don't have the outlet. They don't have the social outlet. So a lot of them are feeling it pretty strongly right now.
Yeah. I think we all need kind of to insert messages of hope whenever possible. That's what I'm going to do right now. I have been listening to this Dr. Jeffrey Van Wingen, and Dr. Jeffrey Van Wingen posted a YouTube video sometime last week or the week before. The video was on how to unpackage your groceries safely if you go to the grocery store and then you come home.
That. Yes.
Yeah, I know. He's had 17 million views in 3 days. So this is his next one. It is a message of hope, and it's just absolutely brilliant. And I think we all need to just take a few minutes. It's only going to be a 3-minute clip. Let's take in the message of hope from Dr. Van Wingen, who has something really meaningful to share with us right now. And I've actually posted it onto my COVID-19-help page. That it's my resource page on the annabaranowski.com/website. So if people want information or how to get all sorts of the resources that we will talk about today, that's where you'll be able to find it. Here's Dr. Wingen.
And so that on that note, I just want to offer some hope today. I'm a family doctor, but I'm also a science nerd. And while some people collect baseball cards, stamps, I collect quarantine placards from ages past. And in my office today, amidst all the chaos and the confusion with the coronavirus pandemic, these signs on the wall in my office, they gave me an epiphany of hope I want to share with you. You see, we have an illness upon us with no cure. But when these placards were hung in desperate times, no cure was to be had for these illnesses, which are now mostly insignificant. Science won. It kicks the butts of these diseases. Take smallpox, for instance. It's pretty much extinct. Diphtheria, it's mitigated with a vaccine. Measles, mitigated with a vaccine. Mumps, mitigated with a vaccine. Chickenpox, mitigated with a vaccine. Whooping cough, mitigated with a vaccine. And scarlet fever, treated with penicillin. Pneumonia, mitigated with a vaccine and treated with antibiotics. See, science won. And now science needs your help too, because as history has showed us from the Spanish flu pandemic in 1918, if everybody takes social distancing seriously, we can mitigate the toll on society. If you are on stay-at-home orders, take them seriously. The best thing we can do for society is to stay at home. Go out only if you must. This virus gets wheeled the more we have people out and about and in close contact. We have to flatten the curve, give science time to catch up. You see, trust in science has waned lately, and it's taken an unnecessary beating by the spectrum. But please, have hope that those scientists in their lab coats and their labs are in their glory, working to save the day. But in the meantime, stay at home.
So I just love this guy. He is obviously so sweet and so earnest. One of the things that you didn't see, you can go back and watch the live YouTube video link, which is also a resource that you'll be able to find on that COVID-19-help page on the AnnaBaranowski.com website. The placards have these little annotations of the fines that people would get if they actually, didn't quarantine or didn't, stay home, right? So it's so interesting because, you start to realize that, even in those days, all that time ago, people just didn't get it. They didn't get that, how crucial it was. They needed to have kind of restrictions put in somehow, make it personal, that there would be a cost to them if they didn't actually listen. And so it's like it's human nature somehow to just not want to take these things seriously, to not want to fully get that, by helping, by staying home, by, taking care, we help everybody. So it's a hard message for people to integrate somehow.
There's a point that I want to expand on that because I watched both of that doctor's videos, and something that and maybe this is my only opinion, but I'm seeing some more and more what I'm calling fear mongering in some of these videos and news reports that are coming out. And I think going back to our previous subject where people aren't listening, aren't following directions, it's because this sort of hyped journalism is driving more of that fear. And when we're fearful, what do? We move away from that object, that person, that thing. And watching some of these, and one thing that I'm going to say, the best thing I can recommend anybody to do is be careful of what is called CNN stress. I think I mentioned this on the last broadcast, that turn off the TV, the radio, the news, watch it for a half an hour and stop, because it's just flooded. It is overwhelming people with information that it's and sometimes these reports are contradictory of each other. And I really would like to see a little, I don't know if we can tone down the message. I guess we're starting to flatten the curve here in New York, which is great news, and everybody's thinking, hey, you know, it's all over. It is not by far. But I think some people are reacting aloof to this because of some of this a little bit over the top fear-mongering type of media that's out there.
Yeah, that is an excellent point. I'm so glad you're making it. I really think that people need to put themselves on a media restriction. I mean, it's important to keep up to date and know what's going on.
Oh, sure.
But you know, there's a point where it's like, okay, you already know. Now do what you need to do to put the steps in place, and don't use your vital energy going over and over what you already know, but instead use this precious time to learn a new skill, you know, learn how to meditate, do Tai Chi at home, watching YouTube videos, you know, download an app and, you know, kind of learn about strategies to help yourself. I know that 10% Happier, this is a really, really good app. And it's actually one of the better ones out there. And they are offering free access for healthcare workers who want to kind of work a little bit on learning about meditation and developing a little bit of inner peace. And, you know, that's a good thing to do. So, you know, find things that will be helpful for you in managing this that may have long legs to carry you over these months and, you know, maybe years of impact because of this. Like, we need to find ways to get nourishment from things that we maybe didn't expect would be nourishing for us. And sometimes that requires a deep inner change.
Excellent point. And I saw a 2-hour webinar that was aimed for the emergency services this morning. Just outstanding information from Mike Tagman, who is known throughout the emergency services, fire, 911, EMS, all of those. And I was surprised to hear him use the same suggestion that I've been using both in my chemical dependency work and just dealing with responders and stress management and helping them to sort of download. And I've always called it the data dump. He called it the brain dump. But it's a very simple exercise. And before you go to bed, make sure you've got a legal pad with you, and just simply write every single thought that's going through your mind. Don't stop for punctuation, spelling, grammar, nothing. Write yourself to completely nothing left in your head. Mm-hmm. Turn that over and realize, okay, all that stuff's going to be available for me tomorrow. And I have had hundreds of reports, and this may not be scientific, that this has worked greatly for a lot of people who have gone through traumatic events and continuous traumatic events, that because they are sleep deprived and their sleep health is not very good. But here's something for just write out everything that is concerning, worrying, and that you want to make sure that you remember, and put it to the side. And that just helps that whole sleep cycle, that circadian rhythm, to start going back to a normal pace, and just getting all of that stuff out of your brain and onto a tangible piece of paper is very therapeutic.
I love that. That is perfect, and it actually really is supported by research. This whole idea of journaling is a fantastic strategy. So yeah, I absolutely agree with you. I think that's an excellent point, and one that needs to be really highlighted and remembered. One of the things that I want to point out is a new resource that we put up to that AnnaBaranowski.com COVID-19 help page. And it's something that was provided to me by a colleague and a friend, Tom Walker, who works with Orange. And Orange is part of Ontario's healthcare system. Orange provides air ambulance service and medical transport for people who are critically ill or injured. And because they're in the air, like it's an air pressure thing. So it's very dangerous for anybody in that helicopter or medical air transport because of the pressurized system that they're in. So they need to really garb up in their PPE. And so Tom shared with me a manual that was produced by him for Orange. And, you know, it's really focusing on, you know, how to handle your stress. And he used this quote that I think is just great. The quest for certainty blocks the search for meaning. Uncertainty is the very condition to impel man to unfold his powers. And, you know, Tom, you know, explains about, you know, how this is such an uncertain time and that we really have to focus on what we do well. And you kind of let our superpowers help guide us. You know, what is it that you really can bring to the plate? So, you know, he comes up with a lot of different strategies to keeping safe. Go on an attention diet, have agreements, practice gratitude daily, use stress as a motivator. And that's actually a really good one, because one of the things that people say is, you know, God, I just want to stop being stressed. I don't want to feel any fear. But the truth about fear and stress is, if you use it as a guide, as part of your intelligent wisdom system, and you accept it with gratitude, those internal mechanisms can help you identify what you need to put in place to stay safe. So use your stress as a motivator, be assertive, focus on what you can control, connect with people. And this is a really important one. During this time, you know, you make phone calls, you text, you do Zoom conversations. Like, do not isolate. This is not the time for that. We need to feel connected. You know, make a schedule and create structure. So people, if you are not working or you're working remotely in some capacity, make sure that you've got to get up, do things during the day schedule, because otherwise it's going to be a real kind of feeling of like being unsettled in your life. Move your body, listen to music, you know, kind of be friendly with feelings of stress. Don't tense around them. Instead, relax around them and kind of use them to help you understand, what do you need to do to stay well? You know, be very type A about your self-care. You know, do the practices you need to. Talk to your kids, talk to people about, you know, what's going on. So it's also part of the conversation as well. What do you think of that?
Well, I practice that every day at 11:30. I zip down to my local Tim Hortons coffee, get my medium coffee, and come back. It gives me that 15-minute break to get fresh air, get out. I go there so often, they see me drive in the driveway, and my coffee's already ready at the pickup window. So that is my little miniature midday break. I literally stop everything at 11:30, unless it's an emergency, perhaps. Go out, do my Tim Hortons run, and come back in. And to me, that works wonders.
Beautiful. It can be simple things like that, eh? What were you going to say, Brad?
Well, I was just going to emphasize the point you made about the structure and getting out. You know, boredom is one of the side effects of what's going on here right now, and lack of structure and the boredom, you know, can lead to the depression and anxiety and worry. And getting out there and structuring yourself, and like what Dan said, you know, having something to do during the day that that you do every single day, possibly exercising. I mean, these things are going to help, during this unprecedented time. So
Definitely.
I just wanted to add those points.
Definitely. There's a couple more. Well, there's a whole bunch of emails, and I want to see if we can at least respond briefly to them as well. This is from Tom, who says, "Hello, this is shocking regarding that people calling 911 will not be honest with those operators. I suppose there is a bit of a stigma now with the virus, and people are scared that EMS will not respond or will respond slower. And people must be honest with these dispatchers. They are our hope and our lifeline." Oh, thank you, Tom. That's an excellent comment, and one that we need to really reinforce and honor.
And I'd just like to jump in real quick on that. I work a lot with the 911 centers, and they are our true very first emergency responders out of the whole chain. Without them, ambulances, EMS, police would not be able to do their jobs, and they are under tremendous pressure every day. And with this COVID extra pressure, it is really challenging them to sometimes their limits. And
Exactly.
we really need to identify, recognize, and applaud these 911 centers. They're doing a outstanding job at best.
It is really, really remarkable. Oh, and we should also mention the communication operators, because we haven't mentioned them, and they're really, really front and center, taking these really tough calls and, kind of recognizing how tough it is. And also the pharmacists who are, in charge of, a lot of medications and devices, and, the pressure on them is incredible, because there isn't necessarily enough medication. There aren't necessarily enough devices, and what a terrible pressure that is. So I'm going to go back to what I said before. Please help me stay well so I can continue to help you. We all need to be wearing these T-shirts if we're out there, or stickers or buttons or something. This comment is from Ali, and he says, "Hi, Dr. Baranowski. Thank you for the second radio show about COVID-19. What could be some long-term effects of the pandemic on people's lifestyle? And could you please talk a bit about post-COVID-19 life?" You know what? That is a very good question, and I think we're going to have to do another show on that. But I think one of the things that's really interesting is what happened to people in other pandemics, and how a lot of them turned to creative outlets, spiritual outlets during these very, very difficult times, and how from a deep level, these things can actually change us in terms of what is meaningful in life, away from a consumer or superficial distraction focused culture to one where we are deeper and warmer and recognize that we are connected. On the flip side, we may end up feeling incredibly isolated and scared and not want to go out and have PTSD, and all those things are absolutely true, but we're going to have to do a whole show on that one. What do you think?
Oh, I agree. I think if we can use the data that we have gathered with how life and people changed after September 11th, we can, I think, have a excellent scope of what we ought to expect, what we should expect going forward after COVID-19. Yeah, well,
there certainly will be things about all, major events and how people respond, and there are certain kind of known sequelae. I think there may be some things that make this different just because of our physical sense of vulnerability from each other. Some events make people want to spend more time physically together. This event makes people want to, or at least realize that it's dangerous to be in close proximity. Here's one from Anne, and Anne says, "Amen, Anna. Keeping people safe, wear a slogan." Oh yeah, right. Help me stay well so I can continue to help you. All right. She also says, what do you all think of this possible cure, hydroxychloroquine? I know enough scientific studies have not been studied as of yet, and there are a lot of side effects reported by using it, but it seems to help a lot of patients affected by this virus. What do you think? I'm going to say, Anne, that I know that there are a lot of studies that are currently being conducted. I don't think that there's enough information. Right now, it's pretty anecdotal. I can understand why people are hopeful, and yeah, hope is good. But let's be safe and make sure that, you know, if you're going to take anything like hydroxychloroquine, you know exactly what you're taking, when you should take it, and at what dose. Now, I will just say that many years ago, when I was traveling abroad in India, I contracted malaria. So I've actually been on hydroxychloroquine properly for malaria, and I can tell you it's not fun. So be aware that if you're going to go on hydroxychloroquine, you know what you're doing, because the doctor who is your primary care physician is telling you how to take it and that it's okay, because there are some very strong counterindications, particularly if you have pre-existing health problems. So, hey, take that seriously and get the right feedback about it. Okay. Okay. This is absolutely crucial, and this is from. Well, we don't have a name, but we do have a header which is called "Blaming Asian Descent People." I was reading on the internet about some assault incidents occurring to Asian people, children in the United States, and this article I could not digest very well. How can some minds of some people actually think that they have the right to blame Asian people here for the COVID-19 virus in the United States? This has to stop, and the persons who are arrested for their actions should be charged with hate crimes. Oh, this makes me really sad.
Yes.
Well, and this morning's New York Times magazine that I read every morning, their briefing is research is showing that the majority of infections, and this is early information, the majority of the COVID infections here in the United States were Europe-based, not China-based.
Mm-hmm.
And they are using that to combat exactly this. There is story after story of Asian Americans being spit upon, being beaten, being thrown off the trains, being and it goes on, and it just makes my skin crawl that people would have that lack of intelligence to take those type of actions.
Yeah, let's be kind to each other. This is a time when we have to kind of really show up with kindness in our hearts. These acts of violence and cruelty are not going to fix the situation. They're just going to make things so much worse. So thank you for sharing that, and I'm really sad that this is happening. It truly is not the answer. Here's another listener from Brian. He says, an amazing show today. Blessings to the first responders and to all of the hospital staff that are on the front lines of this illness. We cannot thank them enough for putting their lives and their families' lives on the line with all of the associated risks of this virus. Thank you, folks. Thank you so much, Brian, for saying that. Thank you for being part of the conversation and adding that. Really important. This is from Melissa, and she says, I'm a social worker working in emergency response. The strategy being discussed, if anyone wants to look up more information on it, is called free-form journaling. It's a fantastic tool, and you can use it anytime. We would really encourage anyone to try doing it when they feel overwhelmed and feel that they can't focus. It's a great tool for resetting your mental state and being able to ground yourself. Okay, well, that's fantastic, Melissa. Thank you for sharing that. What I'll do is I'll do a little bit of research, or you can send me the links that you think would be helpful, and I can put them on that resource page we have at annabaranowski.com /COVID-19 help. So thank you, Melissa, for offering that, and this fits in really well with some of the comments that you two are making as well. So that's really helpful. So we'll make sure that gets put up. And this is from Cindy. This is so frightening. However, you bring some good light to this topic. For that, we thank you. Just be aware of what we need to do to stop this illness as Anna says, we live in a social media cloud now, and a lot of things we are reading we read is fear-mongering, disinformation, and just plain nonsense. Be aware, be vigilant, be educated, absolutely. And, go to trusted sources, because there is a lot of junk out there. And we definitely want to know where we're getting our information from. And then this is the last one that just came in from Dawn. And Dawn says, amazing show today. Thank you to all of you for all you do. Love the discussion. I want to just get any last thoughts from you, Brad, to start with.
Yeah, I think what would be something to focus on is, we have been talking about the first responders and what they're going through. We've shown our appreciation. I know there are a lot of individuals who have contacted my organization talking about how they can help, because they're just looking for places, venues where they can help these frontline workers who are very much appreciated right now. And I'm wondering if we can just throw out some ideas. Dan, you have a lot of contact. First, I'd like to know, are they taking advantage of of any of the opportunities? And what would you think would be the best way for the frontline people to access help if they need it?
Wow. Well, that's a big, important question. How is it that the frontline workers can ask for help? And then if they're being given that directive, how to ask for help, is somebody listening?
Well, and my hope is that somehow that they are, because we do know from research that if we do intervene, while the trauma is taking place, immediately after trauma, that there tends to be better outcomes. So, and again, I'm hearing from a lot of people contacting, the Academy. It's like, how can they help? So I just,
Nice.
I'm throwing that out there, if there are any ideas.
I think that's great. So, do you want people to get in touch with you, Brad, through the Academy?
They could. They can go to the Academy's website. We do have people who are willing, mental health professionals who are credentialed, who are willing to help however they can, no charge, to meet some of the, the emerging needs that people are experiencing right now.
Thank you so much. So I'm just going to say that, if anybody wants to get in touch with Dr. Brad Lindell, you can just do a web search for the American Academy of Experts in Traumatic Stress, the AAETS, either on the website or through LinkedIn. I know you have some profiles there as well with that wonderful offer. And any last words from you, Dan?
Yeah, I guess I'd like to comment on this. Where can people go to just to talk to somebody? And I think the approach needs to be a little bit more categorized, where if this is an EMS, fire, law enforcement responder who wants to talk to somebody, they want to probably talk to somebody who has been or is in the service, and I think that would be a good idea to try to channel that if possible. And a area for people who are in the hospital emergency room areas, that peer-to-peer, even just talking on the phone, obviously having the right background and training and knowing our boundaries is extremely important. But that's what I'm trying to look for myself, is how can we get the EMT, the paramedic, the firefighter who is fearful, who is scared, who has got these basic emotional and traumatic stress questions, that they can speak to somebody who has walked those in those same boots and be able to just simply listen, what I've always called that ministry of presence.
Beautiful.
And, if that's something, Brad, maybe with the academy and the center, that's something that could be accomplished or not.
So I'm just going to interrupt because I know we're going to go offline in a minute, and we want to make sure that we say goodbye to everybody, and we'll continue this conversation because obviously it's one that is absolutely crucial at this time, and I want to thank everybody, Dan and Brad especially, for joining us today, and all our listeners for sharing this conversation and recognizing all those vital workers out there and trying to figure out some new solutions to help people who are right on the front line. So thank you, everyone, and stay well, stay safe. We're thinking about you. You are not alone.
Thank you for listening to the Bear Psychology Radio Show with psychologist, author, and speaker Dr. Anna Baranowski, right here on Reality Radio 101.